Thank you all so much for joining us for this very important conversation about mental health during the COVID-19 pandemic. My name is Yasmin ALTWAIJRI, and I'm the head of epidemiology research at King Faisal Specialist Hospital and Research Center, and I'm a visiting fellow at Harvard Medical School. On behalf of our hospital, King Faisal Specialist Hospital and Research Center, thank you all for joining us. This is the very first event in our new webinar series on mental health and COVID-19 pandemic, where we bring together leading experts in the field of mental and public health to discuss the latest evidence of COVID-19 and its impact on mental health and ways to address it. This session will be recorded and shared on the King Faisal Specialist Hospital website, as well as on other social media platforms. And as we all know, we are currently in the midst of a global pandemic that has brought unprecedented measures of physical distancing and social isolation in countries all over the world, resulting in significant changes to our daily lives. While such measures have been critical to controlling the spread of the virus, they have negative consequences on our mental health, including feelings of stress, anxiety, fear, and loneliness during this time. Understanding the potential short-term and long-term impact of the pandemic on our mental health, as well as ways to mitigate the problem, is an issue of great importance and urgency. I'm hoping that today's conversation will help us shed light on this problem and dig deeper into the nature and scope of the problem and how we can tackle it. We will start with Professor KOENEN to give us an overview of where we are in terms of the effects of the pandemic on our mental health. Professor KOENEN is a clinical psychologist and professor of psychiatric epidemiology at the Harvard T.H. Chan School of Public Health and leads the Global Neuropsychiatric Genomics Initiative of the Stanley Center for Psychiatric Research at the Broad Institute. At Harvard Chan, Professor KOENEN does research and teaches about trauma and post-traumatic stress disorder, and also co-leads the training program in psychiatric epidemiology and biostatistics. Professor KOENEN's work also uses research findings to advocate for evidence-based prevention of PTSD and response to trauma survivors, particularly victims of sexual violence. Professor KOENEN, the floor is yours.
Thank you so much. Thank you for inviting me. And I'm honored to be here, and I hope that we will see each other in person again at some point. Yasmin, that would be great. It won't be Boston this year, but so just give me a second and I will pull up my slides. Great. So hold on, actually, go back to the beginning, sorry. Okay, so thank you. So thank you for having me. So as Dr. ALTWAIJRI,
Yasmin, you can just call me Yasmin.
Yasmin, I can just call you out. Yasmin, thank you. People always get my name wrong. Had mentioned, I'll provide an overview on mental health and where we are in the COVID-19 pandemic. And just to mention, I will also repost things on Twitter, and the link on the bottom is a link to forums that we've had in the past, which have some different address some different mental health issues, including sleep, etc. So people want to take a look. So there's many things that Yasmin mentioned that have about COVID-19 pandemic that are important and to consider when thinking about how the pandemic is toxic to mental health. And so I'll just talk a little bit about the context. So, you know, we've all seen these pictures. These are taken either locally or ones I took from the web. So we're all in the situations of having had the pandemic, have many changes in our daily lives. So there's the threat of sickness and death, but also things like not being able to get certain products we're used to getting. Where I live, the top corner picture is from where I live in Boston, where the parks have been closed. Now they're open, but we have to maintain physical distancing, and you're not allowed to sort of play soccer or do other things that people would do normally. And so these are some of the things that come to mind when I think of how the characteristics of the COVID-19 pandemic and mental health. So it's something new. So none of us, although some of us may have experienced other epidemics, if we experienced Ebola or SARS, depending on where we live in the world, we haven't experienced a global pandemic. It's the first one in our lifetimes. It's also a situation with a lot of threat. There's threat to our physical threat to the health of our loved ones. It's been really unpredictable. I'm not sure about people's experiences in other parts of the world, but I can say in the US where I live, it seems like information on what's going on changes, day to day, and in the early stages, hour to hour. And generally, people feel a sense of lack of control. There's just only so much we can do to deal with it. On top of that, the other things that people are experiencing are social isolation, which Yasmin mentioned, bereavement, so people dying from the disease. And in the US, we've had rising stigma against certain groups, particularly Asian Americans, around the pandemic. And so what do we know from prior epidemics or pandemics? So if we look at other ones like Ebola or SARS, we did see people who studied those did find adverse mental health consequences. So what did they find? So one example is, a group that is people are very concerned about is our older adults. So older adults are at higher risk of morbidity and mortality from COVID-19. And people who did research on the SARS outbreak in Hong Kong found that older adults were at increased risk of suicide related to SARS, and also really the isolation from SARS. And I can talk about this personally because I have a 78-year-old mother who lives in a different city. She lives in Atlanta, Georgia. And really at this point, she's been social distancing from people since early March. And it's been really hard. And I would say now the hardest thing for her to deal with is she's scared of getting sick, but is just feeling very lonely and isolated. The other thing people are finding is that even after recovering from something like SARS, and we're seeing this in COVID-19 survivors, is that survivors have some mental health consequences. And some of these clinicians are telling me are like post-traumatic stress disorder. So if you have severe COVID, you recover and it can, you have a lot of anxiety about getting sick again, or that you're having something that reminds you of COVID. So we can also see long-term effects, even people who have recovered from the illness. And some of the long-term mental health effects we might expect we're seeing in the Ebola epidemic. So this is one study of the Ebola epidemic where they went back to a community affected by Ebola a year later. And these were in survivors or people who were never sick. And they found that really about half had some anxiety, depression, or PTSD symptoms. And if we look at where folks have been publishing on mental health effects, there seems to be more and more coming out every day, but the data is showing that there does seem to be some widespread mental health effects of COVID. So what are some of the things people have shown? So one is that among healthcare workers, we're particularly high risk. And so these data from China showed adverse mental health consequences in frontline workers in Wuhan, which is where the first outbreak of the disease came from. And also a population-based study found that adults who consumed a lot of social media, which many of us are doing around the disease, had higher levels of anxiety and depression. And I think what's really striking here is, I think I highlighted this in a slide, is that you saw levels of anxiety and depression about 50%. So quite high in people. These aren't people who were sick. These are people who were just reading about it. So just the sort of news of it and of the pandemic and sort of all the anxiety surrounding it, having mental health effects. And people have called, there's a number of articles I could have put in this slide, but people have really come out and said that there might be a public mental health crisis during and following the pandemic. This is in China, but there's been similar articles about Europe and other parts of the world, US, et cetera. So what can be done? And my colleagues will talk some more about this, but I'll just give briefly some things, some ideas. So I think public health folks and the public at large need to think about a public health effort to address mental health in the COVID-19 pandemic, and not, simply wait for it to be over. It's likely to last quite a while. And think about, well, what can we do now to help improve mental health outcomes and improve our own mental health? So something we've been thinking about is, this was something from Google had earlier, I haven't seen it recently, but do the 5 to help stop coronavirus: wash your hands, cough into your elbow, don't touch your face, keep safe distance, stay home when you can. Now the big emphasis in the US is really on wearing masks. And so if we thought about like what might be a 5 for mental health. So I actually brought this up in one of our talks that I gave in the back in March. And one of the audience members, she suggested this specific 5. So it's called Reach for Mental Health. And so I'll go through it, but I want to give her the credit. She's on the bottom of the screen, LOWE. So one is to recognize that mental health is a problem. It's sort of natural and easier to focus on COVID, the virus, as the problem, which it is. But the virus itself, the consequences of it, and the social distancing we need to do to prevent the spread has its own mental health consequences that we need to recognize. And if we look just at the US, where I live, we know that recent national polling data suggests that Americans are worried about their mental health. So for example, this was some data. This is probably about a couple months old now, but it said, so it was earlier, but that a large 47% of Americans were saying that the sheltering in place was having a negative impact on their mental health, and 21% said it was a major negative impact. The other thing is thinking about expanding the safety net, and that we can think about things we do to support people during this time as a way of, as a mental health intervention. So for example, in the US, we've had huge layoffs, and we have a huge unemployment crisis related to the consequences of the pandemic. So to deal with the pandemic, a lot of businesses have been closed. And as a result, a lot of people have lost their jobs. And we know from other studies, studies around the world, that losing your job or your home, your finances, your financial security can have a negative impact on mental health. So by expanding the safety net, by supporting people through those kind of economic crises, we're also improving the chance of people having better mental health outcomes. So, things like we don't normally think about mental health interventions, but like in halting evictions, meaning people won't have to leave their homes, making sure daycare facilities are open for people who have to work, and, doing economic interventions like the stimulus bill in the US, those are actually can have positive consequences for mental health, or at least prevent negative outcomes. And for example, just say back in the 2008 US financial crisis, we and many other people studied the economic consequences of the crisis and found that there were mental health consequences. So this is one paper we did, which was on home foreclosure, and home foreclosure was associated with increased risk of anxiety and depression during the financial crisis. So thirdly, assist those most at risk. And in this case, there's many groups who are at increased risk of mental health problems during this time. I think all of us are stressed and sort of somewhat struggling. But in terms of thinking about some populations specifically at risk, is if people have pre-existing mental health problems, or people who are suffering from addictions and recovering from addictions are definitely more vulnerable. Families with high conflict and histories of domestic violence, families with special needs children. In the US, schools have been closed, so families often rely on schools or childcare situations to help them with special needs kids, and they haven't been available. Anyone else already socially isolated, for example, like the elderly and healthcare workers. So a lot of at-risk populations, but each of these probably needs some of their own interventions. And one of the things I've been thinking about and seeing a lot in my community is people finding a way to help. And I know this is an international audience, so I think that any advice in this regard would have to be quite specific locally. But this is just one example from my neighborhood where people got together to get funding to buy masks and then deliver masks to hospitals, or to find places, for example, in the US, like car repair shops have masks. And so people collected the masks from car repair shops and delivered them to hospitals when we were to deal with mask shortages. But I think if there's ways people can find to help in their own lives, whether it's help members of their family, their community, their apartment building, that can not just help the community or help other people, but doing things for others feels good to us and can improve our own mental health. And, just to encourage the people who may be in medicine or in science out there, I do think doing science is helping. It can sometimes feel very distant from the acute needs people are feeling, but just some examples of things out there in the science world that are I'm seeing people doing is, for example, this is just one example because of a group, someone who I know from Harvard, but him and folks in the UK have been developing apps to detect COVID-19 hotspots. There's a number of efforts like that. We have, my colleagues and I have done this health and well-being of pregnant and postpartum women survey. So these are some of the things we're doing, but there's a lot of science going out there, and I'm very hopeful that science, and especially developing treatments and a vaccine, will really help get us out of this crisis. The fourth thing is to cultivate resilience. And what are some ways to think about that? This could be a whole talk in itself. But one of the things we've been working on is things like we're doing right now, but at Harvard, we've been having mental health forums. So this is an example of one we had in the past. We have more this week, but is developing evidence-based mental health content for communities, like Yasmin is doing tonight, and having them available, and also having them available to the community, but having them available online afterwards. And then finally, I just want to mention the importance of having empathy. So this is something that's always sort of challenging, but having empathy during this difficult time for oneself and one's family members, because everyone's struggling or everyone's in a new situation, and also for those around us. And one of the things that's been nice for me is I have a dog, so I walk the dog, and I'm able to, as I walk the dog in my neighborhood, I get to see some of the ways people are expressing their empathy and connection to the community. So these are just some examples I took pictures of, which is people leaving out signs for people doing deliveries. And then someone, I don't know who this is, has been leaving throughout this whole pandemic, has been leaving these little rocks, painted rocks around, so that I see them. There's new ones every single day when I go out. I see them smile, love, hope, laugh, which I really appreciate. And so I encourage everyone to reach for mental health during this time, and I'm happy to answer questions. Thank you so much. I'll stop my sharing. Thank you.
I think Yasmin is on mute.
I think so.
There you go.
Okay.
Thank you very much, KARESTAN.
Yeah,
It was a very nice introduction to the webinar. We received some questions by email that I'd like to ask you.
Oh, sure.
Can you talk about how to counter the stigma related to COVID-19, particularly towards those who've been infected with disease or who are exhibiting symptoms in public, such as coughing or running nose?
Yeah, so that's a really good question. So I think a couple things is, one, the more that like public health officials or governments or any of us can put out good information about the illness and about what people can do to protect themselves. I think people are less likely to stigmatize other people if they know what they can do to keep themselves safe, which is like, it's where big things, wearing a mask, washing your hands, all those kinds of things, keeping distant where you can. I think the other thing is in that regard is the more people can get information about the usefulness of testing, or as testing becomes more available, then we actually know when people are better and aren't at risk of shedding the virus. So those are some things. I think some of the stigma has been around because the information's been so confusing. I mean, again, I can only speak to the US, but it has been kind of inconsistent and confusing. So the more that it can be consistent and reliable, I think the less people will, people stigmatize other people because usually they're confused, they're anxious, they're looking for someone to blame. Which is, natural when people are scared, but good information can help counter that.
Okay, that's great. And the other question is about social media use.
Yeah.
In this region, we're one of the highest per capita users of social media. And I'm sure that based on the research that you've explained, that explains a lot of the anxiety that people are experiencing. Can you tell us more about what is this relationship between social media exposure particularly during COVID-19?
Yeah, it's a tough one. It's so, so the challenge, so social media, so I'm on Twitter and Facebook too, and I'm on social media, and there's a great benefit. It does help us stay connected, actually, and it helps us get information rapidly. The problem with social media is that there's no filter on the information we're getting. So it does lend itself to, and things that get a lot more attention, get retweeted, tend to be more extreme. So things are like, everything's going great, doesn't get retweeted, but the world is ending, gets retweeted, right? So I think to be aware of that, I really do encourage people, and I do try to do this, and I know it's hard, to take social media breaks. I think that we kind of feel scared to take a break, like we're going to miss something. But if you can take breaks, especially around if you're having trouble sleeping, around any time whatever your routine is, but when you're supposed to rest, take breaks, try to take that hour off, not sleeping with your phone by your bed, or turning the notifications off. So one of the things I've done is turn the ringing notification off for Twitter, so that I have to actually check it versus like every time a tweet comes in, like going things. So I think trying to use some of that, because the constant inundation with all the bad, a lot of it's bad news, does increase our anxiety. And I don't think it really increases our consumption of good information, because we will get anyway.
And then one question we received online was, how do you suggest we assist people with pre-existing mental health problems?
Yeah, I think that's a really good question. And a colleague of mine in Boston did a survey with the Department of Mental Health on people with serious and persistent mental illness, and found that they had their loneliness had skyrocketed. So there was they were like the 100% were above in the high risk loneliness category. So I think a couple of things is where they can find resources. So helping people, one of the challenges with many different mental illnesses is challenges around being organized, maintaining a schedule, and reaching out when you need help. I mean, if you're very depressed, the hardest thing to do is to reach out. And now the social isolation, now you're actually told to stay home. So I think things like helping people, it's really boring advice, but helping people maintain a schedule, getting up at the same time, even if they're not going to work, eating at the same time, depending on where you are in the world, if you can get outside or at least walk around somewhere to get some exercise. And then really kind of reaching out if you know someone in your life with a pre-existing mental illness, reaching out and trying to help them stay connected. So are there things, if they used to go to a group, is there something available online? Can they replace some of the things they were doing online? I think those are some of the things we can do, because, and then the other thing I try to remind people of is all of us have been through difficult times in our lives just because we're human, and people with pre-existing mental illnesses even more so. So helping them remember, well, what helped them in the past? What were the things that worked for them in the past? And see what of those they can do now.
Great. Thank you so much, KARESTAN. We're going to move on to our second speaker, but before that, I just wanted to mention, feel free, KARESTAN, to answer any of the questions.
Okay, I will. I saw some of them want links and stuff, so I can do that.
Yeah.
Right? I can do that.
Great.
Okay, thank you.
So now we move to our second speaker, Dr. Sarah Ryan Lowe. She's a clinical psychologist and assistant professor in the Department of Social and Behavioral Sciences at Yale School of Public Health at Yale University. Her research focuses on the long-term mental health consequences of a range of potentially traumatic events, as well as the impact of such events on other domains of functioning, such as physical health, social relationships, and economic well-being. Her work explores the mechanisms leading from trauma exposure to symptoms and the role of factors at various ecological levels, from genetics to neighborhoods, in shaping risk and resilience. Dr. Sarah, the floor is yours.
Thank you. I'm just gonna get my presentation up. So first off, thank you so much for having me. It's really an honor to be on this panel with all of you and presenting here today. So I'm going to be talking about research on the longer term mental health impacts of mass trauma. And I'm going to start off with a few questions that are going to frame my presentation. So first, what are mass trauma? What are their short and long-term mental health consequences? What are some risk factors? Which exposures have the most persistent effects? And what are some of the pathways to long-term psychiatric adversity? And I'm going to end with some application to how these research findings may or may not apply to what we're seeing now with the COVID-19 pandemic. So first off, mass trauma. So mass traumatic events are those that affect not just individuals, but entire communities. They also affect infrastructure, social networks, and relationships. These include natural disasters like earthquakes and hurricanes, technological disasters like oil spills, terrorist attacks, and I think what we're seeing with the COVID-19 pandemic, given the impact it's having on people's lives and well-being, certainly qualifies as a mass trauma. So in terms of what some of the at least short-term mental health consequences of mass trauma are, I tend to put them in three different categories. So first, trauma-related disorders. So these are psychiatric disorders for which trauma is a prerequisite, so part of the diagnostic criteria, including acute stress disorder and PTSD. The difference between them is that acute stress disorder are reactions that occur in the first month after exposure, PTSD a month and later. Both characterized by re-experiencing symptoms, avoidance, and alterations in arousal, mood, and cognition. But then we also know that mass trauma are associated with increased rates of other psychiatric conditions, even when trauma is not a prerequisite. So major depression, generalized anxiety disorder, and substance use disorder. And certainly we heard about these in KARESTAN's presentation. And then also other clinical phenomena that don't necessarily fall neatly into diagnoses. So non-specific psychological distress or general psychological distress that underlies a variety of conditions, internalizing and externalizing symptoms in children. So these are mood and anxiety symptoms and conduct and behavioral attention symptoms, respectively, increased suicidality, and also negative health behaviors. So substance use that doesn't qualify as substance use disorder, binge eating, sedentary behavior, and that type of thing. We also know that at the individual level, there are many risk factors for psychiatric adversity in the aftermath of mass trauma. And here I've organized them temporally, so by timing. First, starting with pre-disaster or pre-mass trauma, these are things we know about people before an event even occurs that increase their risk of psychological dysfunction. So some robust predictors are demographics like female gender, indicators of low socioeconomic status, pre-existing mental and physical health conditions, having low social support or being socially isolated, having been exposed to other trauma and stressful life events. And then there's mixed findings for the last two, with some studies showing that racial and ethnic minorities are at increased risk, as well as older adults. The second period is peri-disaster, so that's kind of what we're living through right now, the time during the mass trauma and its immediate aftermath. So I've listed a variety of specific exposures that are associated with adverse outcomes, and these tend to fall into certain categories. So subjective exposure, so the perception that one's life is in danger or one's loved ones' lives are in danger. Also emotional responses during a trauma, such as dissociation, having a panic attack, and then sort of more objective exposures like physical injuries, bereavement, and certainly those are things we're seeing a lot during this pandemic, as well as media exposure, and KARESTAN spoke about that a little bit. We know that the more time spent consuming media, be it TV, social media, news media, is associated directly with heightened symptoms. And then once a mass trauma is over, the risk factors don't end there. So financial strain and continued disruptions, either stemming from the mass trauma or otherwise, increase risk. And then exposure to additional trauma and stressors, either related to the mass trauma itself or unrelated. So over time, so we know, overall in populations, there are elevated levels of psychiatric conditions, but if you look within the population, you find these different trajectories or patterns of psychological responses among people. So this is a figure from George Bonanno at Columbia University that I really like, showing prototypical patterns of psychological responses after trauma. The most common is resilience, so a trajectory of consistently low symptoms or well-being. And it's been theorized that in the aftermath of any potentially traumatic event, this is the most common. But there are these other reactions too, including chronic elevated symptoms, short-term elevations that decrease over time, and a recovery trajectory, as well as delayed onset symptoms. So these trajectories have been shown empirically. This is data on PTSD symptoms and depression after Hurricane Ike, which was a major hurricane that affected areas of Texas here in the United States in 2008. And we showed trajectories that mapped on to what was hypothesized. And notably for both post-traumatic stress and depression, the modal response was resilience or consistently low symptoms over time. So I want to point out that this study concluded within the first 2 years of exposure, and that's typical of the research that's out there, although there are some studies that have looked further on. But it's relatively few and far between. So just as a sampling, I did a review of literature published in 2018, and we found that only 11 of the studies looked 5 years or more after the disaster, and only 2 looked out a decade or more. So we know a lot less about the long-term impact of these types of events on mental health. I've been fortunate to have been a part of a study that has looked longer into the aftermath of a trauma. This is the RISK study, or the Resilience in Survivors of Katrina study. And we've followed about 1,000 women, mostly low-income African-American single mothers, so a high-risk group, who all experienced Hurricane Katrina, which hit the New Orleans area of the United States in 2005. What's interesting about this sample is that they were actually part of a different study that was going on in New Orleans prior to the hurricane, and we have 2 waves of pre-disaster data on them, as well as 3 waves of post-disaster data, 1, 4, and now 12 years after the hurricane. So looking at their overall rates of psychological indicators, so I have here the dashed lines are probable serious mental illness, the dotted lines are probable moderate or serious mental illness, and the solid lines are probable post-traumatic stress based on their survey responses. And the takeaway messages here are really that at 12 years after the hurricane, rates of mental illness remained higher than pre-disaster levels. suggesting that exposure had some long-term effects for some participants. Another takeaway message is that while PTSD dropped pretty consistently in the years after Katrina, even 12 years after the disaster, 1 in 6 of our participants had probable PTSD based on their responses, suggesting that for some people, exposure has sustained effects. So in the study, we also looked at trajectories, similarly to our Hurricane Ike study, and we found, again, that about 70% fell into what we might call a resilience trajectory, but that there were other trajectories, one of subclinical symptoms that decrease, that we might call recovery somewhat, as well as a trajectory of about 8% of the sample who had chronically high symptoms that actually increased over time, although not significantly so. We looked at predictors of these trajectories, focusing on what we knew about the women prior to Katrina exposure, so demographic characteristics and pre-disaster resources and vulnerabilities. And we found that there were some significant predictors without exposure in the mix. So Black race and probable mental illness prior to the disaster were associated with recovery versus resilience, older age, a greater number of benefits, which is a marker of low SES, more physical health problems, and probable mental illness prior to disaster were associated with chronic responses. However, when we looked at hurricane exposure, we found that many of the pre-existing characteristics no longer became significant, suggesting that some of their risk is mediated through greater exposure to the hurricane. And I'll talk about that in a little bit. We've also, with this study, looked at which exposures are associated with short, medium, and longer term effects. So most of the research on mass trauma uses inventories of different stressful and traumatic events experienced during the mass trauma or disaster, rather than looking at specific experiences. So in a recent paper, what we did, and this is sort of a complicated figure, but we looked at each different exposure we had, adjusting for pre-existing characteristics and demographics, and their impacts on post-traumatic stress and psychological distress at 1 year, which are the squares in red, 4 years, which are the green squares, and 12 years after Katrina. And here we have plotted risk ratios, adjusting for pre-existing characteristics. The takeaway message here is really that if you look 12 years after the disaster, very few of these specific exposures had a significant impact on the odds of disorder. However, some did. And then the second takeaway message is that the most impactful exposures were those similar to what we're seeing now in the COVID-19 pandemic. So lacking medications and medical care, perceived life threat, and bereavement were some of the most robust predictors of long-term mental health in the sample. And then our research has looked a lot at the pathway. So how do pre-existing vulnerabilities and exposure work together to shape long-term outcomes? And so I have my 3 sets of risk factors here, and just going through how they affect mental health in the long term. So we would think that pre-disaster characteristics affect not just post-disaster mental health, but they also shape exposure to a mass trauma, which we're certainly seeing here with COVID-19, as well as experiences with recovery. And similarly, that exposure not only directly affects mental health, but also shapes stressors and other risk factors in the post-disaster period. And then we'd hypothesize a bidirectional relationship between post-disaster mental health and post-disaster stressors and risk factors, meaning that not only do post-disaster risk factors affect mental health, but mental health problems in the aftermath of a mass trauma can actually make things more stressful and increase risk in that recovery environment. So we've been beginning to look at this type of model empirically with the data that we have available, and I'm just going to give you a quick overview of what we found. So our pre-disaster risk factor here is trauma exposure, so the number of traumatic events a participant had experienced prior to Katrina. And we hypothesized that this would be directly linked to long-term post-disaster PTSD, as well as indirectly linked through other variables, such as pre-disaster mental health problems, disaster exposure, short-term psychological responses, and post-disaster trauma exposure. And we also hypothesized that these would have downstream effects on each other all the way down the path. And in a nutshell, we found support for this type of model, although interestingly, the pre-disaster factors of trauma and psychological distress did not have significant direct effects on long-term outcomes. They were completely mediated by these other variables along the pathway. So bringing us back to COVID-19, what might we expect based on the research? Well, we know that most people will be resilient. So they will have consistently low symptoms over time, but we know that substantial proportions of populations will have short and longer term symptom elevations. We know that there are these pre-existing vulnerabilities that shape responses in large part through exposure. So, having a pre-existing mental or physical health condition, having low social support, having low income are going to exert their effects in part by increasing exposure to the virus. And we also know that exposure will continue to have long-term effects largely through its downstream impacts, such as through disruptions to financial systems and work-school relationships and so on and so forth. So what can we do? And I think KARESTAN has already spoken to this. We can decrease both subjective and objective exposure. So, practicing physical distancing to decrease morbidity and mortality, but also managing our subjective responses, coping with emotional reactions, controlling what we can, and paying special attention to those who have pre-existing vulnerabilities. And then as much as we can also preventing longer term impacts by mitigating these downstream effects on finances, social networks, as well as acute mental health problems. So that's all I have. This is my email. I'm happy to be in touch and to answer questions either on the forum or afterwards. Thank you.
Thank you very much, Sarah. That was a very interesting presentation of how the COVID-19 could possibly be connected to all of these different risk factors. We received some questions by email, and we also have in the Q&A, which you're welcome to answer after we finish answering these couple of questions. The first one is, can you tell us more about the post-traumatic growth, which is the positive psychological changes that occur after a trauma exposure, and if this is something we're likely to see during the COVID-19 pandemic?
Yeah, so I'm happy to talk about that. So post-traumatic growth is a concept with long historical roots. The term itself was coined by Richard Tedeschi and Lawrence Calhoun in the 90s. And it's psychological growth in the aftermath of trauma that tends to fall into 5 domains. And if I can remember all of them, it's growth in relationships with other people, a greater appreciation of life, a greater sense of personal strength, a sense of more possibilities in one's life, and spiritual change. And it's been observed in the aftermath of a variety of traumatic events, including mass trauma, like disasters and terrorism. And I think we're already seeing evidence of post-traumatic growth now. People talking about how they appreciate like the little things in life, that they are, reconnecting with loved ones and having deeper conversations, that they're turning to their faith to cope, and that's been really effective. I think what's interesting about post-traumatic growth is that it's often correlated with distress. So it can be kind of a silver lining of having a psychological reaction, that, coping with one's elevated symptoms and stress can actually yield post-traumatic growth in the long term.
And in your presentation, you talked about resilience a couple of times, which is a very important factor to have. So the question is, how can we build resilience in the community in the long term?
Yeah, so I think that speaks to, the question speaks to varying definitions of resilience. So resilience is sometimes conceptualized as, a personal quality or an outcome, but I really see resilience as a process that unfolds over time, where, a person works through the stress in their lives or a major trauma to come out being psychologically well. And in terms of how to boost that, I think, at the population level, looking at people who we know from prior research are less likely to be resilient, due to pre-existing characteristics, whether they're mental health conditions, physical health conditions, in the context of COVID-19 being older, and helping them build some psychological resources or psychosocial resources. So helping them cope, find meaning, and also, connect socially with other people. And then, at the individual level, doing the same types of things. So, KARESTAN mentioned some of these more boring routine things that we do to manage our mental health, like maintaining schedules, practicing good health behaviors is going to bolster our mental health. And then also, reaching out to your community and doing things like that can foster a sense of growth and resilience over time too.
And do you have any advice for healthcare leaders on how they can support the mental health of their healthcare workers and frontline staff?
Yeah, I think that's a really good question. And I'm actually involved in a healthcare worker study right now. We haven't published anything yet, and we're just beginning to analyze the data, but we collected data from healthcare workers in hotspots throughout the United States. And so we found some both risk and protective factors so far in that sample. Some risk factors that are modifiable are having PPE available consistently, and also making sure that people aren't being overworked. So, definitely hospitals and other entities are calling on people to do things that they don't typically do. We were talking prior to the webinar on people working in ICUs when they hadn't before. I think, that is necessary. We need the support there, but we found that people who are working more hours than they typically were at increased risk of mental health problems. So, protecting healthcare workers from burnout, I think, is really important. I think offering basic mental health services to healthcare workers is essential, so that they can identify when they are experiencing symptoms and, learn how to cope with them. And also acknowledging, the challenges both at work as well as outside of work. A lot of healthcare workers are experiencing changes in living situations because of their COVID-19 risk. And just talking about how hard that is and the challenge that poses for one's social and family relationships. Talking about discrimination they might be feeling as a healthcare worker, and processing those types of experiences. And then we also know that team cohesion and support was a protective factor amongst healthcare workers. So, trying to build that by having open communication and dialogue, checking in with members of the team and making sure they feel supported. So some ideas.
Very, very useful information that I hope we incorporate some of them. Actually, in our institution, we began a healthcare workers mental health psychiatric distress survey. We hope to have the results of that very soon. Also, in a project that me and KARESTAN worked on together, which is part of the World Mental Health Survey Initiative, we did a national survey in Saudi Arabia in 2015, where we measured psychiatric distress as one of the modules of the survey, and we are now going back to that same group cohort, and we're doing the survey amongst them again, and trying to see the difference in psychiatric distress during the pandemic. So the results of that also is going to be very interesting to show change, hopefully provide some evidence for our policymakers. Thank you so much, Sarah. Feel free to answer the questions in the Q&A if you find anything that's relevant to your talk. Our next speaker is Dr. KRISTINA KORTE, who's an instructor at the Chester M. Pierce, MD, Division of Global Psychiatry. Her research aims to identify cognitive and neurobiological risk factors associated with anxiety and traumatic stress disorders, the development of evidence-based preventative interventions and treatments for these disorders, as well as creating novel strategies to enhance treatment-seeking behaviors. As a global clinical research fellow, Dr. KORTE aims to adopt empirically supported treatments for use on anxiety, PTSD, and substance use disorders for use in low-income settings. Dr. KRISTINA, the floor is yours.
Thank you. All right, so I'm going to share my screen. Okay. So thank you for that kind introduction. And today I'm going to talk about some different strategies that we can use in order to help cope with some of the anxiety that we may be experiencing. So the thing I want to start with is considering, if you're thinking of the COVID-19 pandemic, we're really living in a state of a lot of uncertainty. And so when we're experiencing uncertainty, this can lead to a lot of stress. We might be experiencing some symptoms of panic or kind of elevated levels of fear, especially right when the pandemic began to start, as well as symptoms of anxiety and also feelings of worry or concern about kind of the future. And the good news is that it's actually normal to be feeling stressed. If you're feeling stressed right now, that is pretty normal to be experiencing at this point in time. And anxiety and worry, fear, panic, all of these are going to be really common when uncertainty is present. So stress and anxiety can be protective. And at lower levels, it actually helps us to identify and respond to various threats that are in the environment. And it also helps us plan for the future. But once our levels of anxiety and stress gets to higher levels, it can begin to be problematic. So one thing we know is that everyone tends to respond differently to stress. And in order to be able to cope with stress or the anxiety that we're experiencing, we really need to be able to identify when it is that we're experiencing stress. So stress tends to affect our thinking, our emotions, our body, and our behaviors. So in terms of thinking, if you're feeling stressed, you might begin to notice that you're beginning to have a lot more trouble concentrating. Maybe you're more easily distracted. Perhaps you're having some trouble remembering things. In terms of our emotions, we might be beginning to have a lot more kind of negative emotions. We might be feeling, the anxiety, sadness, frustration. We might also begin to feel quite irritable and even anger. In terms of our body, we might begin to notice that if we're feeling particularly anxious or stressed, we might notice a lot of tension in our body. So maybe holding tension kind of in your shoulders, around your neck. You might begin to notice that, as well as having a decrease in energy. You might begin to notice that maybe you're feeling more agitation. So maybe you're kind of having, moving around in your seat a lot or really can't sit still. Also, you can have headaches or even sleeping problems. And in terms of behaviors, we may begin to notice that maybe we're no longer doing things that we normally do or tend to enjoy doing. Maybe we're starting to isolate ourselves from other people, perhaps beginning to get into arguments and even sometimes engaging in reckless behaviors. So how can we actually reduce our stress once we identify that we are experiencing stress? I like to think of stress reduction in terms of two main areas. The first one is considering things such as basic self-care and daily social rhythms. And these are actually things that both Sarah and KARESTAN have hinted on already. And then the second piece are specific strategies that can reduce anxiety. So I'm going to start off with some of the basic self-care, and I'm going to actually go through this fairly quickly since I am aware that we're running pretty low on time. But in terms of our daily social rhythms or these self-care kind of components, our different eating patterns, our sleeping habits, and our exercise and activity level. So if you think of when you're experiencing anxiety or stress, what we tend to notice is that our eating, our sleeping habits, our exercise, activity, all of those are things that tend to get more irregular. So maybe we begin to eat at different times, maybe we're no longer sleeping as well, and we're not really paying as much attention to kind of our activity level. And so if we're able to have balanced daily social rhythms, what's really important about this is that it helps us, it provides stability, it helps us regulate our moods, and then also provides a strong foundation for dealing with stressors. So having a balanced daily social rhythms, what does that look like? That looks like eating regular meals, being able to maintain daily routines in your schedule, Also things like showering, getting dressed every day, especially when we're dealing with, maybe working from home. It's really important to try to make sure that you're putting specific routines in your day. And then also getting good sleep hygiene. And what that means, there's a lot of different sleep tips, but some of the main ones to focus on are trying to make sure that you're going to bed at the same time each night, as well as getting up at the same time each morning. And also trying to do perhaps relaxing things before going to bed, instead of if you're kind of on your phone a lot or watching TV, that can also tend to activate your brain and make it more difficult to sleep, as well as engaging in physical activity. And what I mean by this, it doesn't mean that you have to do intense cardiovascular exercise, but this can actually be just doing things like keeping your body moving, whether this is household chores or just doing things around the house. And so once you're able to, if you're able to maintain your daily social rhythms, that helps bring that foundation for being able to deal with your day-to-day stressors and be able to cope with anxiety as it comes up in your day-to-day activities. And so now I'm going to focus more on actual anxiety reduction strategies. So the first one I want to focus on are altering our thoughts. So we know that our thoughts can be directly linked to our feelings, which in turn can be directly linked to our behaviors. So when we are anxious, our thoughts really tend to be kind of negative. They tend to be emotion driven, and they may not be all that helpful. And so one thing is, if you begin to notice that you're having a lot of kind of negative self-statements or kind of negative thoughts, it's important to shift, to try to really shift your statements into statements that'll help you function with less distress. An example of this could be, let's say if you're thinking, oh, this is a terrible time. And if you alter that to thinking, this is a terrible time, but I can get through this. What's important about that second component of that statement is that it's able, it recognizes, yeah, this is not a good time, but I know that I can cope with this and I can get through it. So it really enhances that ability to think of things as, this is temporary, I can handle this, and this isn't going to last forever. Another area of managing stress are strategies that are focused on what I like to call kind of increasing tolerance for distress. So when we're feeling distress, we can experience a lot of kind of intense emotions at times. And when we're feeling intense emotions, they can tend to feel uncomfortable and also quite uncontrollable. And we also tend to have this desire to kind of push them away, or we really want to get rid of them, or we want to try to alter this emotion immediately. And so when you're experiencing that intense, immediate kind of this emotion that you just want to push away and you want to do something with it immediately, one thing you can remind yourself is that you may be having a strong feeling, but it's tolerable, and that feeling will fade. And then also that although this is not a pleasant feeling, these feelings aren't going to last forever. So we know that when you're experiencing intense emotions, if you tend to wait about 15 to 20 minutes, that the intensity of that emotion will actually go down. And so some of this can help us from, maybe behaving in a way that perhaps we wouldn't want to behave, because we're immediately trying to respond to, trying to get away of rid of some of that intense emotion. So some helpful strategies to think of when you're in that moment of having intense emotion. One option is to try to delay before responding. And really what we're trying to do is delay, really create space between the intensity of your emotion and trying to delay before actually making a response in a given situation. So by delaying, or you can try to distract yourself by doing something else until the intensity of the emotion passes. So once again, that can be 15 to 20 minutes, maybe up to 30 minutes. You can go to a different room, go on a walk, tell yourself to wait 30 minutes before responding, read, watch TV, all those different things. And this is really just a way that when you're experiencing intense emotions in the moment, that you try to have some space and you're not immediately reacting. And another option is to consider what we call acceptance. So this could be, instead of trying to actively change our emotions, we can actually accept them for what they are. We often refer to this as riding the wave of strong emotions. And with this, we try to really observe how our emotions show up on our body without judgment. So you might be able to kind of take a moment to just reflect on, I'm feeling really anxious right now. And kind of, that's just what you're experiencing at that moment, instead of having this connotation of I'm feeling anxious and that's really bad. But instead you're accepting it. So the next piece is looking at various relaxation-based approaches. When we're feeling anxious, we begin to have kind of a lot of bodily tension. And that's where we have the tension in our shoulders and our neck. And so we tend to just kind of clench our body. And over time, we begin to have a lot of trouble knowing when our body's feeling tense and when it's actually feeling relaxed. So the goal of relaxation exercises is to begin to learn or to recognize when it is that you're feeling relaxed versus when it is that you're feeling tense. And that can be one of those signals to yourself that you're experiencing stress and tension. And then over time, as we're using these exercises, it helps us reduce our tension. And then as we're doing it more and more, so we can reduce the bodily tension. And then over time, we'll begin to notice a decrease in our anxiety and begin to feel calmer. So some examples of this are diaphragmatic breathing or belly breathing. And this is at the end of my slides, we're going to go through and do an exercise in breathing, belly breathing. There's also progressive muscle relaxation, which involves tensing and relaxing your muscles. And this is one of my favorite ones to do. And it really is just, you're going through tensing and relaxing just different muscles, which really enables you to identify when you're feeling tense versus relaxed. Then mindful meditation is effective as well. And so the thing about relaxation-based approaches is that it's really important to remember that they're just like exercise. So regular use of these strategies is important, and the more you do it, the more effective they can be. I often have patients who will come to me and say, oh, I started doing some relaxation strategies and like you recommended, and then I just did not find it relaxing at all. And so that's where it comes into play that you may not find it relaxing immediately, but over time it becomes more relaxing. So trying it for at least a couple weeks every day is where you begin to see the positive effects. So there's also soothing exercises to do, and this really points to doing anything that relaxes you. So considering things like, if you think of a calm state, so when it is that you're not feeling anxious or uncomfortable, what is it that you like to do? Maybe you enjoy reading, maybe you like listening to music, maybe exercising, going on for walks, really just anything that you find that you normally find relaxing is going to help you during that state of anxiety. All right, so now we're going to go ahead and I want to teach you a breathing exercise. And I'm going to teach you diaphragmatic breathing. And what I like about this is that it's something that you're able to do just anywhere. All you need is your body, and you just need to know how to know the breathing strategy. So it's something that you can take with you wherever you're going. And so with diaphragmatic breathing, what we're looking at is we're trying to slow down our breath, because when we're feeling anxious, we tend to breathe really kind of short breaths and quite rapid breaths. And that tends to increase our anxiety. And so by slowing down our breathing, we can actually reduce the level of anxiety that we experience. So what we can do is go ahead and we can practice this together. So what I'm going to have you do is, if you take a moment to kind of get comfortable in your chair, and I'm going to have you kind of close your eyes. And as you're beginning, I'm going to go through and read some instructions. And as you're beginning to go through and take in the breaths, I want you to be sure to try to fill your belly with air. So oftentimes when we're anxious, we're kind of breathing up in our chest, and we're not really breathing slowly into our belly. Okay, so take a moment just to close your eyes. And now breathe in slowly and count to 5. 1, 2, 3, 4, 5. And now breathe out through your mouth. 2, 3, 4, 5. So now we're going to repeat the cycle 5 times, and I'll have you do it on your own. And just remember to count as you breathe in and count as you breathe out. Okay, you can go ahead and open your eyes. And so that is just one example of a way in which when you're feeling anxious in the moment, you can use this strategy in order to slow down your breathing and try to begin to relax. And that's what I have for today. So I can go ahead and take some questions.
Thank you very much, Christina. That was a much needed practice. I think every one of us has been very anxious recently because of all that's been going on. I myself was traveling overseas and arrived on March 15 and had to go at the time, any traveler from overseas had to go to a hotel and spend quarantine for 2 weeks. So it was, although it was a very comfortable stay in the hotel, and we were being treated like guests, and everyone was providing us with anything that we needed, but we were really anxious, and I thought that I'll go home and it'll be back to normal, but it didn't. And I noticed everyone was anxious around me. I get a lot of calls from my friends asking me to recommend therapists who can help them with anxiety relief, and I did attend several workshops with Max Strom in the past. Who gives about 4-day breathing workshops, which have really helped me throughout the years. So I really believe in breathing, and also I rely a lot on apps. And I would like to know what you think about the apps that we find on the App Store. I understand there's over 1,000 apps, behavioral health apps on the App Store. Would be interesting to know, are there any that stand out that have been tested that are more approved by your team?
So I do have go-to ones that are for recommendations. So I do like to recommend the Calm app as well as Headspace.
Okay.
So those are just personal preferences, and my patients have all found those quite effective. They also have a lot of kind of different options. So some mindfulness meditation, some kind of other just breathing exercises, some have some components of progressive muscle relaxation. So I like them because a person can select different components depending on what it is that they're having problems with.
I use Insight Timer. That's one of the ones. No, I mean, that's just personal. It also has a lot of different, there's a free version.
Yes.
And that version has a lot, same thing. You can do a timer for meditation with sounds, but then it also has a lot of different guided meditations, and like, it has a lot of sleep meditations, which I've used when I can't sleep. So, but I think the ones that I also really like the ones that Christina mentioned.
Very nice. So, Dr. Christina, can you also share some recommendations on how to help a family, like when you have different family members in the house? Are there special ways that they can deal with relieving or coping with stress together?
Well, I think that it kind of depends on what are the dynamics within the family, but generally speaking, each person kind of being able to recognize when they're feeling anxious or stressed. And, so having a little bit of that kind of self-awareness or understanding, when they're feeling anxious, and then being able to recognize, what is it that they need to help calm themselves? Is it trying to do, things together as the family, or is it more helpful to do something that's relaxing on an individual basis, like maybe doing some of the relaxation exercises, or maybe it's exercising, maybe it's kind of getting time apart. It kind of depends on, the dynamics of what's happening. But I think taking the time to recognize, what is it that each individual needs within the family unit in order to help reduce stress and to feel kind of, to be able to address some of what they're experiencing.
And given that youth are probably at higher risk for anxiety and stress and depression, do they have different, or is there any evidence that their coping skills is different or than for adults and other age groups?
Well, I specialize in adults. So in terms of speaking to children, kind of the child response to anxiety, I'm probably not the best to speak to that. I know that we did have a forum focused on that, and KARESTAN was part of that. So she might have a little more to comment on in regards to this. But I think generally when we're experiencing stress, some of the strategies are similar, regardless of the age group.
Mm-hmm. And what about people with pre-existing mental disorders? Are there any special coping strategies for them, or should they just follow the same recommendations that you've just given us? Such as people who already have, for example, an anxiety disorder or depression.
Right. So I think that depending on whether or not they're pre-existing, anxiety disorders, if they're experiencing anxiety already, perhaps they're already kind of going to treatment. And if they've had periods where their anxiety has been particularly elevated, but also periods where it's been reduced, thinking back to what has been helpful in the past. What is it that they've done that's been helpful? Has there been particular techniques that they used during treatment that was effective? Were there particular coping strategies that were helpful? I think that could all be beneficial. The other thing, though, to consider is that if you do have a pre-existing mental health disorder, and if you do notice that you're struggling, then to seek seek services from mental health providers in your community.
Mm-hmm. Great advice, Dr. KRISTINA. Thank you very much. You'll find some questions in Q&A. If you find anything relevant, please go ahead and answer them if you can. We'd appreciate that. I'd like to move on now to our next speaker, Dr. Khalid Saeed, who is a consultant psychiatrist and is the WHO Regional Advisor for Mental Health and Substance Abuse for the MENA region. He's currently coordinating the work on mental health and psychosocial support in emergencies in the region, besides leading the work on scaling up mental health and strengthening public health response to the substance use problem. He also has extensive experience in evaluation and setting up of mental health policies, legislations, treatment systems and services in countries of the Eastern Mediterranean region. Dr. Saeed, the floor is yours.
Thank you very much. Let me get to the screen and see if I can, because I'm finding it a bit difficult to.
That's okay. Take your time.
Is it now visible?
Yes, it is.
All right, good. So thank you very much, first of all. And before I start, I posted on the chat thing that recently, actually this afternoon, we have launched this mental health and psychosocial support platform, which includes a number of exercises and psychoeducation about stress, and also some contacts about different mental health professionals who are providing online services in different parts of the region, including Saudi Arabia. Anyway, so coming back to the issue which I was supposed to talk about, the mental health and psychosocial support considerations during COVID-19, I'm just sort of wanting to step back, because if I remember from your earlier messages that most of the people on this particular meet are not from mental health background in general. So it might be important to remember that mental health is not about mental disorders. It is essentially defines who we are, how we interact with people, how we interact with our environment, how we learn, how we work, and how we overcome adversity and realize our own potentials and go on to contribute. Now, this is particularly important to remember that during the current pandemic, mental health is a resource in the sense that without that, it would be difficult for people to appreciate and follow the public health advice around simple measures like hand washing or maintaining social distance. But more so as we move forward in rebuilding and going back to normal, it would be extremely important that good mental health would be a resource. And if we do not invest in promoting it now and preventing mental health problems now, we would find it difficult to for the countries to go back to their developmental trajectories. But traditionally speaking, it has been an area where people have not invested much, particularly in low and middle income countries and even some high income countries in our part of the world. And you can see from here that less than 2% actually of the health budgets, not the general budgets, just the health budgets are being spent on mental health. Whereas at any given time, 1 in 10 people would have a mental health problem. And over the lifetime, 1 in 4 would have a mental health problem. And what is that resulting in? It means that over 75% to 86% of people who have mental health problems do not get the treatment they need. So that is where the treatment gaps comes in. And at the same time, people with severe mental health problems, they tend to die 10 to 20 years earlier as compared to the general population, mostly because of access difficulties to general health care. Now, during any emergency, it's not just during the current pandemic. We are living in a region where you have countries like Syria, Iraq, Somalia, Libya, and Afghanistan, Pakistan, all the countries which have been facing complex emergencies for a very long period, often 30 to 40 years. And what we have seen is that the need is to set up the response which is multi-layered and multi-sectoral. So this is the pyramid which highlights that. So as you can see, that specialized services just form the tip of the iceberg in this. Basically, the need is to ensure basic needs are fulfilled. And that would mean security, safety, shelter, etc. And then involving and empowering the communities to take care of their own needs. And at the same time, make sure that mental health is part and parcel of general health care as well as social care services. Now, coming to this current situation, as the previous speakers have repeatedly highlighted, that stress is normal and it is common and it is expected. It's not just because people are worried about their personal safety and security, but it's the whole context that it is affecting people's life, their economic opportunities, their educational opportunities, and at the same time, the way we normally lead our lives, basic social interactions are being impacted upon. So all this is resulting in high levels of stress. And if you look at some of the studies which have come out over the last few months, you would see that close to 35%, for example, in case of China, this was the earliest study. And using the same methodology, a study carried out in Iran showed that close to 60% of the respondents expressed that they were feeling psychological distress. While in case of US, you can see that around 45% of the adults in this particular study had been negatively impacted and talked about the being worried and stressed about the infection.
Dr. Khalid?
Yes.
Dr. Khalid, we cannot see your slide. We can hear you very well. You're doing an excellent explanation, and we understand. We're following everything you're saying, but for some reason, your PowerPoint slides do not appear on the screen.
Let me stop sharing it and then start sharing it again.
Yes, yes, please. Let's
Goes.
try that.
Is that now?
Yes, perfect.
All right.
Yes, excellent. Thank you.
In addition, so in addition to that, some studies during April, I think, from Spain and Italy showed that overwhelming majority of parents said that their children are experiencing difficulties, emotional difficulties as well as behavioral difficulties, ranging from simple irritability to difficulties in concentrating, restlessness, nervousness, and feeling of loneliness. Now, when people are under stress, it's expected that they would adopt some coping mechanisms, some of which might be healthy, like the previous speakers were alluding to. And on the other hand, people are also likely to adopt strategies which may not be so healthy, like taking to alcohol or substances. And this is something which is this evidence is starting to emerge, that rates of alcohol use, sale, and consumption are going up in different countries. And some of the studies from Canada and Ireland are there. And at the same time, people are almost, obsessively following the news on the social media or sharing information on the social media. And if there are some studies which do indicate that frequent exposure to social media is related to higher rates of stress, anxiety, and depression. Now, in addition to stress, it is also expected that during emergencies, particularly during the acute phase, there would be a rise in new cases of people with mental health problems. And this is something which has been shown through a number of studies, not only the earlier studies from China, but also you can see from countries like Canada, Denmark, Italy, India, and so on. But this is particularly true for people who have had COVID-19 and were hospitalized. So if you look at the rates of anxiety and depression in them, they were fairly high. About a third of them had depressive illness and about 35% of them had anxiety symptoms. In addition, we are also seeing that it's not just respiratory symptoms people are presenting with. Neuropsychiatric symptoms are increasingly being seen as one of the common presentations of COVID-19. And they are also, particularly delirium, is also associated with worse outcomes. Then I think the previous speakers were also mentioning that during emergencies, it's not only that people are stressed and they tend to trigger newer increased rates of mental health problems, but people with history of mental health problems are also more likely to have a relapse, or it might result in worsening of their condition. And this is something which is again being seen consistently. And it's also being seen that people who are in long-term institutions, including for mental health problems, particularly older people with dementia, if you look at their mortality rates from just one country, for example, in Germany, the case fatality rate for the general population was around 3% in March and April. But for people in institutions, it was over 18%. And if you look at some of the other studies which have come out, you would see that the mortality rates are ranging from 14% to as high as 64% in people living in institutional care. But side by side, what is happening is that the services which should have been made available are also getting more difficult to access, partly because of the fear and partly because of the fact that these services have been repurposed. And some of the psychiatric wards have been converted actually into caring for COVID-19 patients. And this is something which we are seeing in a number of countries, including in this region as well. And in some cases, psychiatric units had to shut down because lack of personal protective equipment, particularly in the earlier part of the response, resulting in lots of professionals having picking up COVID-19. And this resulted not only in specialist services being shut down, but also community-based services being impacted pretty badly. Now, there are certain groups of professionals, particularly frontline workers, who are at a higher risk. And this is something which was seen in the previous SARS outbreak. And this is again being seen in the current pandemic, that there are the rates of mental health problems in frontline workers are far higher than the general population. Then the other vulnerable population, and this is particularly relevant in our part of the world, that people who have been living in adversity, as I mentioned earlier, like Syria, Yemen, Iraq, Somalia, etc. The rates of mental health problems among people who have been exposed to adversity in the last 12 months is that close to 1 in 5 of them would have a mental health problem, ranging from severe to moderate to mild. And you can see the breakdown on this. And similarly, again, relevant to particularly to the Middle Eastern part of our region, that there is evidence that close to 1/3 of workers, particularly expat workers, have developed depressive symptoms, and close to 40% of them have anxiety-related issues. So again, these are vulnerable groups of population which we need to keep in mind. Now, these are basic principles which are there in the Interagency Standing Committee guidelines. But recently, the Interagency Standing Committee on Mental Health and Psychosocial Support sent out and published this particular guidance on COVID-19. And basically, they have advised these 10 basic activities which must be carried out throughout this period of COVID-19 response. And they range from simple activities to orienting the first responders about the psychosocial aspects of COVID-19, to making sure that people who are in quarantine or people who are taking care of them should have access to mental health and psychosocial support. And make sure that, and this is something which we are seeing increasingly, that the national response plans which are being developed and funded in most countries, they should have mental health as an integral component. It should not be an add-on or an afterthought, as it has usually been in most agencies. In addition to that, there are specific messages and specific actions for different groups of populations. And I was looking at some of the Q&As, and in this, it might be helpful for people to have a look at some of these resources which are here. I'll take you through them. That this is the whole list of resources which is available, and this might be a good idea that people should take some time to have a look at. And these resources range from very simple educational and resources to more structured intervention-based resources. And one of the things which might be of interest is this particular story, My Hero Is You, which has been, I think, published in almost all the languages in the world, basically targeting children and parents, taking them through how to talk to children about the COVID-19. In addition, as I mentioned, that we have launched this mental health and psychosocial support platform. So again, it would be useful if people can take some time and go through it, and also see that their friends and their other contacts have access to it. In addition to that, there are certain publications like this particularly brief psychosocial intervention guide for first responders. This might be extremely helpful, that at least when we were talking, I think one of the questions which we had previously was about how we can protect the frontline workers. How can we help the frontline workers handle the stress? So one of the things which we need to do obviously is that besides preparing them for the job they are supposed to do and providing them protection, we also need to make sure that they have basic training on psychosocial skills, which they can use not only to take care of people they are supposed to take care of, but also to take care of themselves and their peers. So these are a range of, as I said, intervention resources which are available, which I hope would be of use to people here. I'll stop here, and if there are any questions or comments, over to you, Yasmin.
Thank you, Dr. Khalid. Those resources are very thorough, and I'm sure they'll be very useful. Will you provide us with a copy of those resources that we can share?
Yeah, I'll share with you the presentation. And
Perfect.
Sure.
Great, thank you so much. So I have a couple of questions that we received by email. Can you tell us about the extent of awareness in the region around prioritizing mental health in the wake of this pandemic?
Mm-hmm. Yeah. Generally now what we are doing is that almost every day we are sending updates to all the ministers of health. And gradually what we are seeing is that mental health and psychosocial support is increasingly being accepted as an integral component of the response. Now, the challenge obviously is that would this interest continue and beyond the pandemic, and would it become a sustainable effort? So that is the challenge we are seeing. At this point, yes, there is a lot of interest and a lot of resources being made available for this issue. But the issue, but as I said, the challenge is that we make sure that this is not just one-off thing. It becomes a sustained effort.
Absolutely. So there have been some examples that have been published in which countries or territories have been able to build better mental health systems following emergencies. And some have identified common threads among some of these experiences. Can you talk to us about these lessons learned and how we can potentially implement them in the region?
Yeah. There are a number of countries. I mean, if you go back to the Indian Ocean tsunami, for example, and in 2004, followed by the Pakistan earthquake in 2005, and then this number of emergencies in our region, which have been now going on at least for 8 to 10 years in most of the countries around Saudi Arabia. So you can see that one of the things which is very, very important is that the policy level engagement needs to be there. Without that, the problem arises that when the money comes in and lots of other partners come in, there would be a haphazard kind of response. So there is a need that there has to be the ownership by the national authorities. And that would mean that there would be a coordination mechanism in place to direct the resources. Secondly, it is important to highlight the fact that mental health is not just restricted to the health systems. While it's important that it should be integrated into the primary health care, and one of the recommendations which is coming out and what we are seeing, for example, from even Afghanistan and Sri Lanka, that at least one health professional in each of the primary healthcare units has to be dedicated for mental health and psychosocial support interventions. And similarly, it has to be linked to higher levels. So there has to be a change in the way the specialist services are kind of, functioning. They are not supposed to be just providing frontline services, which they are doing at this point, but they are also supposed to provide supervision, training, and referral support to the downstream services. And then there is a need to make sure that outside of the health system, there has to be integration of mental health in other sectors. For example, education, nutrition, shelter, social welfare. In all these sectors, we need to make sure that mental health considerations are embedded. And unless you take this longer term approach, this building back better would not happen as a project. It has to be a sustained long-term effort with national ownership. Over to you.
Thank you. And then can you give us, I know it's a very big question, but briefly, what is the WHO recommendation for the general population when it comes to mental health during COVID-19?
I think there are a number of things which we can talk about here, but one thing which is important is that please make sure that you seek the information from reliable sources.
Mm-hmm. Mm-hmm.
Is WHO or your own national health authorities websites. Do not sort of go around looking for information from websites which are providing spurious information, which might be damaging. And secondly, it's also important that while all of us need information and news about what is happening around us, we also need to put some limits, reasonable limits on how much time we actually spend on reading, viewing, or talking about this issue. Then at the same time, while it might be difficult to physically, meet, but with all these different technologies which are there, it is now increasingly possible to maintain your social relationships and build up the social capital in the society. And I think so one of the previous speakers alluded to that we need to make sure that we maintain those physical contacts. And last but not the least, ensure about your own health. Simple things. Start with the basic things. Eat healthy. Make sure that you are taking exercise. Don't start smoking or drug use or alcohol use at this particular point in time. You also at the same time need to realize that there are limits to what any one of us can do. So we need to also be accepting about what I'm able to do. And if at the end of every day, I can just try to recall that what were the 2 or 3 good things which I was able to do, which might be very small. And I think one of the earlier speakers did talk about this, that it's important to remember that every day we might be able to do 1 or 2 things, which may not be earth-shattering, but that might be. And so that means that we also need to be kind to our own self. Over to you.
Thank you so much, Dr. Khalid. I think this brings us to the end of our session. This webinar has been a learning experience for all of us. We will archive we've recorded and will archive this webinar. And everyone has our contact information. Please email us if you have any questions. I really appreciate all our panelists. Thank you so much for your time and for being with us. It means a lot to us to have you here. And I hope we get to see each other face to face very soon. Thank you very much. Good night.
Thank you very much.
Thank you.
Thank you. Bye-bye.
Bye.
Thank you.